Hello, this is Dr. Arkin with Georgia Chiropractic Neurology Center. Today we're going to talk about a really important topic. It's called a migraine, and it's something that millions of people suffer around the country. So this really affects almost 7% of the population. So pretty much every single person knows someone with migraines. And it's a really confusing subject. And if you're like other patients that I've run into, I'd be willing to bet that no one's actually ever taken the time to really explain to you what's going on when you're having a migraine. So there's bunches of different types of headaches, right? We have what's called a secondary headache, and we have a primary headache. A secondary headache is when you have something that causes head pain. So for example, your neck is tight, it causes tension in your head, you get a headache. That would be a secondary headache. A primary headache would be a brain-based head pain. And there's dozens of them, hundreds of them, and they're all named something different, something fancy like a vestibular migraine or a basilar migraine, or there's just bunches of them. But what happens is that in every single one of them, it always boils down to the fact that you are having brain dysfunction, where your brain is not inhibiting pain signals. So what our brain's supposed to do, this is called our cerebral cortex up here, all right? And our cerebral cortex is supposed to send information down into our little brainstem, this area right here. And then our brainstem has secondary modulating centers that inhibit painful stimuli. When you have a migraine, what happens is that your brain fails to do that, and it interprets pain when it should not. And it comes along with many other symptoms, such as numbness, maybe on the face or in the hand, or dizziness, or nausea, light sensitivity, sound sensitivity, all these horrible conditions. And typically what medically is done for these is there's a horrible reduction rate of actually stopping the headaches from occurring. There are some medications that do a pretty good job of stopping a migraine when it is starting. What we really tend to focus on is stopping people from doing what's called activating a trigger. So a trigger would be, so you eat gluten and you get a migraine, or you smell something strong like a perfume and then you get a migraine, or it's a flashy light, you get a migraine. Those are your triggers. One of the first things that you want to do is identify what your triggers are and make sure that you eliminate them. But the trigger isn't actually what causes the migraine. A trigger is just something that sets you off. The migraine is always, no matter what type of headache, brain dysfunction that is not inhibiting painful signals. So really what we do is we like to treat a migraine similarly to how we treat a traumatic brain injury, where we will just fix the areas of the brain that are going through dysfunction, and then you can inhibit pain signals and you no longer experience spontaneous pain. And if you want to know more information about this migraine, check out the blog post that's attached. Ask some questions, we'll be sure to answer up. Typically this is a condition that can be very treatable. It just has to be done appropriately with the brain regions that are dysfunctional in mind. All right, once again, this is Dr. Jonathan Arkin with Georgia Chiropractic Neurology Center. Happy healing.